Oh man. Anyway, good morning, everybody. Welcome to Impact and Coffee on this Tuesday, April 21st. I cannot believe it is almost May in 2020. How is everyone's 2020 doing? Seems like it's a challenging time, but I think we're going to make it through. It's going to be really good. But we have a very special Impact and Coffee panel today on social justice and public health. My name is Robert Nelson. I am a program manager with Grants Collective. I am the co-host for Impact and Coffee. My other co-host, though, is Mariah Harrison. Let's say hello, Mariah.
Good morning, everybody.
And the rest of our team this morning is Destiny Logan over at Global Ties ABQ, Michael Green over at CNM Ingenuity, now going to be with New Mexico Farmers Marketing Association, Aaron Hiokama, who is with the Grant Plan, Jamie Chester, who's with SYNC, Rio Grande Community Development Center, and South Valley Economic Development Center. All those things rolled into one. And then I believe Juan Abeta is lurking over here somewhere in the Zoom call. Good morning, Juan. There he is in the corner. I see him. Awesome stuff. So, let's see, hold on one second. Let me get my agenda straight. This morning we have a very special Impact and Coffee, like I mentioned before. Our panelists this morning, which will do a quick introduction and ask folks to do a quick 2-minute introduction to themselves. But today is a panel where we'll have questions, very specific questions for the panelists today. And then, like I was saying before, this will be recorded, and so we'll have this available on our social media within the next 48 hours. And then we'll release the link to our larger email list this Friday. Mariah, it is Gratitude Tuesday. Is there anything that you're grateful for today?
Gosh, so much. I'm really, really glad that the weather is much warmer. But I also had a surprise delivery yesterday of dinner from a friend, and that was just really the sweetest thing. So I appreciate people in my life right now. How about you?
That's really nice. I'm just glad it's warm out today and not cold like last week. And not snowing, which was also really depressing last week. So yeah. If you have anything that you share that you're grateful for in the audience, please make sure that you share it in the chat. I'll also make sure if you have questions for the speakers today, that you ask those in the chat function. We have Destiny moderating the questions right now. If there are some that we feel we can lift up to the panelists, we will make sure of that. But otherwise, please make sure to ask in the chat function. By the way, the only ones that are not on mute are the panelists and myself and Mariah. So everyone is on mute, and if you are not on mute in the audience, please to make sure that you mute yourselves. We've had some interesting background noise every so often, which is part of the adventure that is Zoom calls these days. So please make sure you're on mute. And without further ado, I think we can get started with introductions. What do you think, Mariah?
Yes, please do. And take 2 minutes sounds like a long time, but we do have the time for that today. So take some time to explain your organization and the work you do, and feel free to really inform us about what's going on right now, or what your organization does.
And before we get started, though, I will give a big shout out to Jesse Jensen, who helped us recruit a lot of our panelists today. I think you're on the call, Jesse. So thank you so much from New Mexico Health Equity Partnership. This meant a lot for us to do this conversation today. So we'll start with, to my right on the screen is Janene Yazzie. Hello, Janene. Thank you so much for joining us, and tell us a little bit more about your work and your organization.
Hi, everyone. It's a pleasure to be here with you guys this morning. I'm Janene Yazzie, and I'm from the Navajo Nation. I'm currently representing San Juan Collaborative for Health Equity, which operates throughout the Four Corners region and addressing social justice and environmental justice, racial justice, and food justice issues throughout the Four Corners area. We have been developing collaboratives around the different issues that we have been facing, and as such are part of the Navajo Hopi COVID relief group that has formed itself in the midst of the crisis that we're facing. And we really work to ensure that we're taking culturally appropriate measures and methods of approaching and addressing the issue. But it's going to be interesting to talk about all of our work and how they intersect and just what we're doing in the midst of this crisis. So thank you.
Thanks, Janene. We'll go next to Sunshine, who is just right next to you, Janene.
Good morning, everyone. I hope my audio is okay. Please let me know if it's not. Awesome. My name is Sunshine Muse, and I'm a health equity person who oversees a nonprofit called Black Health New Mexico. We really work on the health disparity areas that disproportionately impact African Americans. And in the state of New Mexico, those are infant mortality, preterm birth, maternal mortality, cardiovascular disease, and diabetes. And yet we're about 3% of the population of New Mexico, so it's pretty frightening that we would still be second or first in any of those high disparity areas. I've been in New Mexico for about 10 years, really grateful to be here. I come from New York City, which when I was growing up in the 80s and 90s was the quote unquote cultural melting pot. So I feel like I've had a lot of experience in terms of growing up in diverse community of language, culture, tradition, and I'm grateful to bring some of that here with me to the state of New Mexico. And I'm very excited to be on this call with everyone. Thank you so much for having me.
Thank you, Sunshine, and thank you for all of your good work. I really appreciate it. Next is Joseph Hill. Good morning, Joseph.
Good morning, everybody. I am Joseph Hill. I'm with the National Center for Frontier Communities. I also serve on the New Mexico Health Equity Partnership Steering Committee, and I am the co-president of the New Mexico Public Health Association. Just a little bit about the National Center for Frontier Communities, which I'm going to say NCFC from now on because acronyms save a lot of time. We're based in Silver City, but we work on a local, state, and national level to serve rural and frontier communities. If you've never heard that term frontier community before, just think of this as a step below rural. Our state specifically, which I focus on, about 2/3 of the counties of our 33 counties are considered rural or frontier, and 1/3 of the people live in a rural or frontier community. So for our state, that's a significant amount of our population. The way we work with smaller communities is we do a lot of advocacy on state and national levels. We work directly with food systems. We work with nonprofit capacity with nonprofits and smaller communities. We also work with suicide prevention and substance use prevention because these are some of the top issues in smaller communities across our state. And we're getting into work around broadband, and more than ever during this COVID-19 crisis, we're seeing how much broadband is important as healthcare and school and a lot of other things have been transferred to that, yet these smaller communities don't have the systems to truly engage with these things properly. And if you see me mute my video or I cut out, it's because I live in a frontier community, and we'll see what happens. But yeah, I'm very grateful to be with you all here today, and I'm excited to hear what everybody brings to the table. Thank you.
Awesome, Joseph. Thank you so much. And last but certainly not least, Enrique Cardiel with the Bernalillo Health Council. Good morning, and thank you for being here today.
Hey, good morning. Thanks for having me on. So my name's Enrique Cardiel. I'm a health promotion worker. I'm currently the director of the Bernalillo County Community Health Council. I see a lot of folks who are affiliated to the Health Council in one way or the other on here. It's great. Lee used to be one of the directors. Matt Cross works with us. Virginia works with us. And yeah, so the Health Council is now a nonprofit. Health councils were originally started by the state as child and maternal wellness councils, and became community health councils, and then the state cut their funding. So for Bernalillo County, that meant the county government picked up the council for a while. And in 2015, the county stopped funding the council, and so the council became a nonprofit. I actually think the funding probably stopped in 2014. And then it took a while for the council to get set up as a nonprofit. And so we work to try and be a supportive public health entity for Bernalillo County. Albuquerque is the largest city in the United States without a local city or county health department. We have a state health department, and that's a great thing, and there's great folks working there, work really hard. We started, because we became a nonprofit, we had to do the funding thing, so we started receiving funding on opioid issues, which is definitely important. But we're also looking at healthy eating, active living. We do that through Presbyterian. Accountable health communities, also partnership with Presbyterian. And we're looking at youth substance use, and started partnering with the city this last year and starting to do some general public health work and planning. So we're trying really hard to kind of fill the gaps in public health the best we can with our staff. As far as health council go, we're the best funded and largest with 9 staff. As far as like the public health needs of Albuquerque and Bernalillo County, I just like to compare 9 folks trying to improve the health of the county with 1,500 law enforcement trying to reduce crime. And we see where we've chosen to invest as a community. So I don't know if that's 2 minutes, but I'll stop there saying I'm grateful to have the privilege to still be working at this time, and to get to deal with the challenge of thinking about how we keep our communities healthy at this time, and for the recovery, right? Because the train wreck that we're dealing with right now, even though it's in slow motion, will be short compared to how long the recovery process will take.
Thank you.
And once again, Joe Hill for president.
I will say, Joe, that when Enrique talks about that kind of stuff, especially, he kind of wills it or speaks it into truth. So he did that with our mayor currently. So
I'll take it.
Yeah. So why don't we just dive into the questions? So our first question today is, we know this has been an extraordinarily challenging time for a lot of organizations and a lot of communities out there. Why don't we go one by one? What challenges has your organization faced in the past month? And we'll start with you, Enrique. Why don't we go there?
Okay. Well, I think the challenge has been to put into place social distancing while trying to work with community. So we've looked at how essentially our office is closed. There's only one person allowed in the office at a time. So I usually go in evenings if I have to sign stuff, checks and things like that for folks. And just really for a group of people that are used to working with people, right, that's just incredibly difficult. So we're not, right, one of the things we do is coordinate syringe pickup trainings. That's just cut off for now because we're not getting a group of people together. We're trying to deal with funding stuff, right? Some funding sources still want us to work at the same capacity that we were working at before. And other sources are being totally flexible and supportive. So it's just kind of an interesting time to think about how we do that. And then the reality that there's been a lot of expectation for the Health Council to participate in response and recovery, but really, we weren't funded or set up that way. So it's just kind of additional work. So it's been hard for me as an individual to, and seeing people talk about, well, I have lots of extra free time now. That's not me. And also just recognizing again that it's just a privilege to be able to continue to work and be paid at this time. I think if we weren't getting paid, some of us would probably still be working. But realizing that that there is a privilege in just continuing to have income and employment at a time when lots of many millions of people are being laid off. I'll stop there.
Thank you for that. It's good to hear that some folks are still working. Obviously, we still have a plethora of folks who are not. And so we'll move on to Janene. What challenges are you facing with your organization, with your work?
Well, I think what's really difficult is that we're seeing how all of the gaps in access and in equity are exacerbating the ability to respond and provide relief to the communities in a way that would help stem the curve. Everyone's been seeing our nation in the news because of the rapid rise in the amount of cases and in the amount of deaths. And we're being on the ground, we're hearing that those numbers may not be accurate enough to really capture what we're dealing with in our communities. An example of this is that the Navajo Times finally did an investigative piece on how the mortuaries are overrun by a lot of people who are dying in their homes and who aren't then being tested because we don't have postmortem testing, but who, from the information from their family members, have been experiencing signs of COVID. And so this just goes to show how the lack of health equity and access to healthcare systems and healthcare in general is really disproportionately impacting our families and our communities. And those issues, like some of our panelists have been talking about, of the lack of digital sovereignty and lack of access to information communication technology, has really made it difficult to get timely information and resources to those that need it most during this time. The canceling of schools has also created more issues because a lot of our families and children were meal dependent and went to school in order to get meals. And so the ability to provide the grab and go lunches or to provide other means of getting these meals to children has been a challenge because a lot of these families live very far away from the school, so they depend on the school buses to get their children to school and to these central locations to pick up meals. And so we're seeing that, a lot of the existing injustices and systemic issues that we were dealing with are compounding even our ability to respond and provide equitable relief to our community members. And so we're constantly having to shift. It's a completely different way of organizing and of providing relief. I mean, all of the health and safety protocols that have to be taken into consideration. It's not the way that a lot of our partnership and our wider collaborative the partnerships that we've developed through the collaboration have been used to organizing, so everyone's had to retrain and to just reassess and reevaluate our own capacities to be able to address this without becoming victims ourselves, but then also to provide those services and those relief in a way that is safe, that are efficient and effective to really help our communities in this time. And like the way that a lot of resources have come down to address these disparities, very much dictated and framed by the welfare state. And so it's not structured to support a household of families and individuals with a spectrum of needs. Instead, a lot of the programs and the information that is available to help inform how we deliver aid and how we address the issues that are preventing people from being able to stay at home, self-isolate, quarantine, or prevent any other form of transference of the virus. Like the structure that was in place was literally only targeted high-risk individuals within the household, There was a lot of individuals that fell through the gaps, especially like single parent homes with children that have special needs. But luckily, San Juan Collaborative for Health Equity, you know, in the pre-COVID life, we're already looking at and identifying these gaps and addressing and building connections and family groups to be able to start to articulate how to best address these needs. And so that was really helpful in the shift to really already have those connections. And so one of the ways that worked out is that a lot of the partners that were working in the schools and providing a lot of educational resources and educational equity and training for parents, that allowed us to mobilize immediately for when food boxes became available and other supplies became available. We were able to target with those community partners, getting this to high-risk homes and homes of children with special needs right away. And so far we've served 257 families on the New Mexico side, but we're constantly having to shift and reevaluate and do almost like what I call organizing gymnastics, to change with the new information, the new challenges, the new gaps, the new hotspots, the new needs that arise every day as families are forced into quarantine for longer and longer periods.
Thanks, Janene. It's important to hear your perspective out there, and it means a lot. Joseph, why don't we go to you next? What challenges are you facing, or are your organizations facing?
Yes. So yeah, we've run into a lot of challenges. Many of them were spoken before by Janene and Enrique. I think the one that we're dealing with a lot is just geographic equity. And just even speaking directly about COVID-19, just things like testing, for instance. I'll give you an example. Where I live currently in Hidalgo County in the metropolis of Lordsburg, we are right in between two international airports on the interstate. We have a lot of traffic, and I want you to think, everybody to think of when you're traveling and you stop in the middle of nowhere to get gas, that's where we live. And so they have access to a lot of people, but when their shift is over and they go home, they may end up carrying this virus. And I can definitely tell you that there's really not much testing going on. You can look at the Department of Health and see how many tests have been given in rural areas, and just go outside of Las Cruces and the Albuquerque area and see how many people have been tested in general. You'll see that in a lot of cases, it barely hits double digits. And then on top of that, a lot of communities don't even have close access to hospitals, for instance, and people are not used to even going to the hospital, because if you have to take an hour or two drive to your hospital, a lot of times you learn to get creative with those things. And so built in the culture, there's this mindset of not expecting any type of medical assistance and not receiving any type of medical assistance, which exacerbates the problem even more. But then there are other practical issues, as we're all social distancing, and we have to do things differently. Broadband speeds, you're going to hear me talk a lot about this in just about every question that comes up. We work with people with low or no connectivity. All of the things that we're doing online, it's not accessible for a lot of people, or they're now in a position to use technology that they've just truly never had to use before. But maybe other people might be more used to it, or at least surrounded by it in some way, so culturally even understanding it. And then just a lot of our programs, things like our prescription drug drop boxes, so we can lower drug overdoses in our community, things like that have virtually shut down. All of our in and after school programs have pretty much shut down. All of the work that we have with our farmers and people that work in the agriculture industry, and what we do to make sure to help them bring their food to the market, has been severely complicated or delayed. And food is one of, they're perishable items, so that's complicated too. And then also another thing, and Janene mentioned this, just about how this reveals things that are already there, equity issues that are already, they were already a struggle before. For many of our communities, the state resources they access, like anything that comes from CYFD, whether it's juvenile justice or child protection, a lot of things like that in various departments, they come from usually places outside of their community, and in a lot of cases, places outside of their county even, where there are 1, 2 hour, in some cases 3-hour drives for them to work with or meet with that entity. And that was difficult before all of this. In some cases now, it's nearly impossible. And so all of the issues that were already there have kind of been brought up to that next level. And so those are the challenges that we're running into. Yeah.
Thanks, Joseph. I appreciate it. Janene and Joseph, I think a lot of what you highlight is what goes on outside of our urban areas more than anything, and something that we need to hear and understand more and more so. I'm going to shift to Sunshine. Could you talk a little bit more about the challenges you're facing with your organization and with your community?
Yeah, so to be fair, because I had a moment, I took some notes. So it's not off the complete top of my head, but echoing what a lot of people said, some of the challenges that we're having are the lack of good and solid public health information, be it from a content and access standpoint. So the leadership that we have in the country right now is challenging, if not a mess. And so the notion that the public health information that we're getting is good or excellent is a fleeting notion, not a fact. And then in terms of access to information, this is an issue that marginalized communities always have, and in a crisis have at an exacerbated rate. So that's a big deal for us. Obviously, the disparate pre-existing chronic conditions and how that impacts people's care now and risk for contraction of COVID-19 and its impact. That's a big deal for us, but it's directly related again to access to good public health information and care that's non-exclusionary and not racist. These things persist, and the data shows that. We have to move to an online platform. We can't just lay down while this happens, but at the same time, it's a challenge because we didn't necessarily have that plan or infrastructure in place. I'm happy to say that the way that our funding is and the way that our project plans have been written, there's a way for us to make that shift, and there's some funding behind it that we don't have to go out and search for. So I'm really grateful for that. And it does make me think, as an executive director, how can I plan now for the future for the unexpected and write grants in a way that really honor the value of technology and really budget to demonstrate that honor. And I didn't do that before because I didn't expect us to be in this position as a country or a world. There's a lack of pre-existing infrastructure that's going to help us to positively define the rebuilding phase. So Enrique was talking about recovery. Culturally, we don't have necessarily a funded infrastructure to help us recover. And that's obviously beyond the nonprofit, but we work with people, we serve the people, we serve a national movement. And so it's heartbreaking to know that in the year 2020, we're still in a place as marginalized people where we don't have that type of funded infrastructure. Racism in pre-existing and acute care, right? There's some data emerging across the country that says that the way that intubation and ventilators are being utilized is directly influenced by racism and bias. And somebody spoke about whether or not people feel that they can and want to access care based on pre-existing trauma around care access and abuse. Policies and practices that are racist, exclusionary, and earth-hating continue to pass and be implemented in the midst of this crisis. And because we're in response mode and because we don't necessarily have infrastructure or political power, these things are happening without our influence. And I think for me, that really points towards this challenge that we tend to have around a lack of influence over the narrative. So the narrative that's emerging right now about COVID, about social distancing, about what the world should look like, about the invisible enemy, this like atrocious move to shut down, ban immigration right now, we don't have influence over defining the narrative. And that's incredibly dangerous for us.
Thank you, Sunshine, for lifting that important point up too. And New Mexico is a rising majority state, meaning that it's predominantly communities of color. And so we are experiencing severe health disparities because we are disproportionately affected by a system that has been disinvested for many years. And the reason for that disinvestment is racism in a lot of ways. So if for those who don't know, federal funding for public health across the country has been decreased by 45% over the last 15 years. That's a lot of money. And so, which is why we're having this conversation today, because we need to know what's going on in our communities. So I'm gonna toss it over to Mariah to ask our next question and keep us going.
So maybe in relation to these specific challenges, we're interested in learning more about how collaborations or existing collaborations with partner agencies have changed over the last couple of weeks, again, to address some of these challenges and inequities. Can you talk to us a little bit about who you're working with and how that's working? Let's start with Joseph, please.
All right. Okay. So, we actually came up with a term for this recently. We've been having a lot of strategic mission creep. Our efforts normally are focused on long-term systematic changes, but lately they've been focused on more short-term need. In this time, now I preface that with saying that even though we're focused on short-term need in this moment, we're taking notes and we're learning all of the stuff that we're seeing that has been either elevated or highlighted during this crisis that can go back into our long-term strategic change as we look towards the future. So we've always worked hard to break down silos and work with any organization we can, whether it's state or local, whether it's a foundation, a nonprofit. A lot of times we work with federal entities or entities that are outside of the state. Those partnerships have definitely been a lot more creative. But some examples of working with people that maybe ways that you may not be used to working, not just in this crisis, but even before this crisis, were things that we were really looking at, because we do have a problem with, even though we're all working really hard to work outside of our silos because we understand things are connected, funding is usually siloed. And that's the issue. At the end of the day, we all have to, if we're working on grants, we have to make sure we're delivering on those deliverables that are given to us by the people who ultimately sign our checks. And so that's really getting us thinking about how we need to approach things in the future, especially on our advocacy end, and how a lot of state programs and state agencies want us to work. There's problems with that, and that system doesn't work. A good example of how we work with other entities to help us, the people in our communities, is we've been working with the Anderson Foundation, which is a foundation out in Austin, Texas. And they serve mostly Texas, Colorado, and New Mexico, but they really haven't had much penetration in New Mexico. One of the agencies that they were working with is the Food Bank of Eastern New Mexico. And if you aren't aware of them, they're up in Clovis, and they serve 5 different counties. And I think it works out to something like 13% of the state as far as the needy that need access to food support. And they actually underwrited us to work with them and to build them in their strategic planning. And everybody's far away from each other, but it's breaking down those silos. And I think that's the key thing. That's the thing I'd want to leave with all of you that are on this call today when we talk about how we move forward and how do we work through this. We have to really think about breaking down silos, not just in how we work, which I've been a part of, and many of you have been a part of conversations for years about this, but also how that funding is set out. That funding is in silos, and that forces us to jump back into our silos, or make us competitive versus collaborative. Yeah, so that's what I have on that.
I appreciate that, Joseph. Thank you. 13% of the state is a lot to address too. That's a lot of really valuable information. I didn't know about that food bank and about the Anderson Foundation. So go ahead, Sunshine, would you mind talk to us about what partnerships you've grown or seen something new come out of to address these challenges you mentioned?
Hi again. So I am taking notes. It's the writer in me, but it helps me. So some of the things is that we've always relied on community expertise to lead the public health messaging in our communities. So we do believe that communities know how to solve the problems that we're facing. The challenge is often that we just don't have the resources or power to do so, or that we have direct forces stopping us from access to decision-making bodies, funding, etc. So consequently, what we've been able to do in this time period is sort of expand the folks that we're working with to a more national platform. And that's really exciting because we're meeting new people that have framework, philosophy, expertise, information, lived experience that we didn't have access to before, or we didn't know we had access to before because we had a more narrow pool that we were working within. So our community is changing and our community is expanding, and that's really going to empower the type of information that we're able to bring through on our virtual platform.
Can eliminate those things that many of us in public health knew were issues to begin with, knew were issues before, but now they're public news, right? Now we're talking about how do we pay grocery store workers more because they're in danger. They've always been in danger of infectious disease more than most of us. We're just now recognizing it, right? The other thing that I saw in the questions pop up, is just, and I don't want to cut it off, but behavioral health, right? We talk about folks being heroes and we do things, and it's probably a good thing to tell folks they're heroes, but a lot of people that are going to work at a grocery store or doing food are going because they have to, right? They don't have paid sick leave. They don't make enough money to save up money to say, hey, I can opt out of this and stay home and stay safe, right? And that stresses people out, right? And April is supposed to be Stress Awareness Month. Excuse me. And I think we're all very aware of stress at this point. But how do we change it so that people can be healthier, have the support they need all the time, right? We're figuring out a lot of things now. How do we figure that out long term? So we're just trying to change our conversations and looking for the gaps in who we need to be partnering with more. So hopefully that answered the question somewhat.
Yeah, absolutely. And it gives us a lot to think about too. So Janene, if you wouldn't mind, go ahead and give us your answer in a brief, and then we'll wrap up with probably one last question. And, also, those of you that just a little bit of housekeeping, please continue sending in your questions. That's totally fine. We can relay them to everybody, or you can be answering in the chat. Those of you that are our panelists, if you could please put in your organizational info in the chat and include your social, because we want to be sure to tag you in Facebook and Instagram where possible. And then I think, and then also, if we have one more announcement before we're finished that comes from a suggestion from one of our team members, Juan. But to move us a little bit forward, Janene, go ahead and answer, and then I'll turn it over to Robert. Thank you.
Okay. Yeah, no, as I mentioned before in one of my earlier responses, a lot of the work that was done by San Juan Collaborative for Health Equity to address these gaps in equity work and approaches in our communities really laid the foundation for how we continue to build collaborations into addressing the COVID crisis. And so those were already partners who were brought to the table, because we have an extra challenge being working with Indigenous communities and having to also train or retrain collaborators and partners and allies in how important and why it's important to center culturally based approaches in both how we look at and understand the issues that we're faced with, the roots of those systemic inequities, and the types of solutions that are necessary to address it. And this is always an ongoing process and challenge when working with partners and bringing them on board. But the partnerships have always been a broad base, because we are working within a sovereign nation. We are working with Indigenous communities that are under multiple layers of jurisdictional authorities. And so by necessity, working on any equity issue, we had to partner with universities, with schools, with state, tribal, county officials and representatives, with healthcare workers, with educational workers, with traditional knowledge holders, with community stakeholders. And the strength of the collaborative has been that it's always been led by people who are rooted in community and who have the lived experience and the in-depth knowledge of what our families are facing on the reservation. And so I really have to hold up the work done by our co-founder and our coordinator, Hazel James Tohi, who's also on the call. I shared her information. I hope she doesn't mind. So you can reach out to her and get some more information on just like the wonderful breadth of work that's been done pre-COVID, but how that's also translating into how we look at and inform partnerships post-COVID. And a lot of this is really been really helpful in informing, like for example, we're partners, the Navajo Hopi COVID Relief Group is partners with the new relief fund that has been created through a collaboration of giving organizations as well as state officials, because of that longstanding relationship that we've had, but also the way that we've been able to use that infrastructure that's been created to create rapid relief and response. And the reason why that's important, like our specific and unique approach, is because of a lot of the questions that you're raising. You know, like we can't talk about behavior health and Indigenous without talking about the impact to the environment, the impacts to spiritual well-being, the impacts to and the legacy of the destruction of family units through the history of colonization, of assimilation, and of settler colonialism, and how that's embedded in all of our institutional responses to these issues. You know, and in dealing with the COVID crisis, we're seeing another shift back to a narrative we've been working so hard to overcome, and that's the poverty porn narrative about just how poor and how desperate our communities are because we lack access to clean drinking water, we lack access to electricity, completely ignoring the history of systemic abuse and resource exploitation and of economic bondage and oppression that has been carried out methodologically in our communities to create the situation that we're in now. And so we're working overtime to try to take back control over that narrative, and our coordinators really working hard to create culturally appropriate materials and processes to address the behavioral health issues that we're seeing in our communities, because we were already dealing with high rates of youth suicide. We were already dealing with high rates of domestic violence, of alcohol and substance abuse. And what has been proven effective in our communities is addressing these issues from a culturally relevant perspective, because these are knowledge systems, these are pathways that restore the wholeness of the person. And like, just because we're in the midst of a crisis where we're forced to pivot and respond and like also address like the sudden influx of funding sources that are for particular COVID responses, and that are taking away from other long-term work and resources that were already scarce to begin with for food security, water security, health equity, to go into rapid response, are challenges that we're constantly having to hold all at once. And so the partnerships continuing to be broad, but also re-educated and reframed around the narratives that are empowering, that keep the focus on the root issues of the injustices and the disparities that we're seeing, and that ensure that as we address this, we don't lose sight of long-term, meaningful resource resource appropriation for the things that are going to matter most, the building of critical community infrastructure, the building and expanding of not only broadband access, but digital sovereignty. You know, it's not just about access to poor and low-income communities and families, but it's about being able to control that critical infrastructure, because it is just as necessary as running water and as electricity for the future of a sustainable economy. But that needs to be under a democratic control of the local community, the local population. So things like this we cannot lose sight of, because this is what's going to help us really achieve and continue to work towards systemic equity that benefits everyone post-COVID.
I'm just sitting and breathing and processing. And Janene, I want to thank you so much for that, for those really critical points that every one of us can find ways to support and support that narrative. And I want to also say that Impact and Coffee team has already spoken about having many of our panelists back for another set of giving you an opportunity to speak, because there's so much information to share and so many ways that people can get involved. So this isn't the end of that conversation, and I know that there's so much to share. Please know that we'll have you back again to talk more. And so I'm going to turn it over to Robert to wrap us up for this hour. And if you have questions or suggestions or want to add your social in the chat, please do so. Thank you, everybody.
Thanks, Mariah, and thanks to our panelists for being here today. I will also add that if you have any other community announcements, anything that's happening with your organization, or just what's happening in your community, please make sure that you add that to our chat. You can also add that to our Facebook group, ABQ Impactors. If you're not a member of that group, just go on our Facebook, facebook.com/Impact and Coffee, and there's a group join link that you can actually press the button. We'll get you onto that group as much as possible. Our last question of Impact and Coffee is always the same. It's what can our community do for you today? And so we'll start with Joseph, if you're still on the call. I think you're still on the call.
Yes, I am. So I think a key thing that we need help standing. We need voices to join with our voices, especially when engaging with advocacy. I'll give you a good example. Our state has the Office of Substance Abuse Prevention, right? This is a state agency that deals with substance abuse prevention. The problem is that if you look at the numbers across our state on who are the most vulnerable and who are the most impacted, many of them don't even interact with the Office of Substance Abuse Prevention. That doesn't make any sense. I understand that there's less population there, but if your office is created to solve a specific need and you aren't serving the people that are affected by that need the most, then what are you doing there for? And we need people that are in metro areas to amplify our voice so that people will listen about the rest of the state. And so that's something we definitely need. We need power. We need to be able to share our power together to help everybody and to make sure everybody gets an equitable chance for already doing. It's not even about stuff for us. It's about making sure that the stuff that's already out there gets to all the people who need it.
Thanks, Joseph. That's a really good point. I think we're better together than alone. And so we'll move forward with Enrique. Could you share what our community can help with you today?
I think really the biggest thing is to look at and learn from things that are possible right now, right? Example, Kroger's paying people $2 an hour extra to work in their grocery stores, right? For this period. That means that was possible before, right? There's places where housing is being provided where there wasn't before, means that can happen. Healthcare, right? People are getting healthcare that they couldn't get before. So that means that could happen. So we've been lied to all these years, and some of us knew that, some of us didn't. We were being lied to that these things were impossible. These things couldn't happen. We couldn't pay people to stay at home, right? That would destroy the economy. Right now, if we can't get people to stay at home, we're going to destroy the economy. So the fact that we could spend, trillions of dollars in one afternoon to try to bail out the stock market, but we have yet to spend $1 trillion on regular working folks, right? Hold that up, hold that back, right? The city of Albuquerque is, as an example, is putting porta potties along Central and other places, right? Because people need access to restrooms because unhoused folks can't go to businesses that are shut down to go to the restroom now. So that's another sanitation and public health issue. That could have been done all this time, right? But we let it slide, right? So don't accept what was the normal January 1st this year. Don't accept that crap. We have to hold up all the possibilities that we're seeing now as whatever the new normal is, right? We can solve these issues. The resources are there. The capacity is there. We just have to keep pushing to make sure that the will stays there long term, right? All of a sudden, we can do all these amazing things we couldn't do before, right? And we're doing that. Oil is at negative $30 a barrel, and these things are still possible. So we need to keep pushing. And that's not just for us, that's for everybody, right? It's for all of us, but that'll help us as well. Because we are stronger together, right? And we've known that, and now some of us are being forced to practice that when we weren't used to it before. Some of us are learning how to be better at it. We just got to keep doing it. How do we make solidarity normal, right? That's really public health, So I like to tag out on a lot of my things. Solidarity is good medicine, and so I think practicing that, supporting, even in Albuquerque, there's that group, right? ABQ Mutual Aid, right? That's just community solidarity in action.
Thanks, Enrique. I really appreciate it. Sunshine, what can our community do for you today?
I think platforms like this are really important that allow people of color to help to define and shift the narrative around this. We need folks to remember that we've been in crisis forever, pre-COVID, and that COVID is more of a magnifying glass than a defining, it's not the definer of the crisis that we live with every single day. And we need funders to continue to be flexible and to actually seek out organizations led by and for people of color so that we can begin to build infrastructure that's going to be lasting towards the type of things that Enrique and Janene and Joseph have been talking about today. So more platform, more narrative shifting, continued collaboration. I want to talk to everyone who's been on the panel after this. I loved the fierceness of your voices. Keep coming back. It works if you work it, and we're freaking worth it. We have to lead.
Thanks, Sunshine. I appreciate that. And last, but definitely not least, Janene, could you close us out and tell us what we can do for you in your community?
Yes, I've shared a lot of information for how to contact me and Hazel if you're interested in collaborating on the relief or recovery efforts in McKinley County and San Juan County. But also if you just want to exchange ideas, I think this is, just to speak to what Enrique was saying, this is an extraordinary opportunity to learn about all the things that were possible before, these radical shifts and transformations that we're always told were either too unrealistic or too expensive. We're seeing in real time taking place. And it's time to build off of that, to create a new direction for our communities and our economies. And as a part of that, really exercising and protecting each other as a state state where the federal government is falling short. You know, like we're dealing with a public health crisis on our reservation because of the cumulative exposures of extractive industries in our lands and the crisis that it's created pre-COVID. And now in the midst of this, with oil prices down, which is something we should all celebrate, we're also seeing federal relaxation of environmental quality rules around methane and coal emissions that are going to further endanger a lot of our communities. And we know this pollution doesn't know boundaries, right? It's not confined to the reservation boundaries, but we're at the forefront of the impacts. So I think continuing to collaborate and build unity and conversation and knowledge exchange at this point in time is going to be really crucial for building a foundation for how we all move forward together. And so we're invested in that. So thank you.
Thank you, Janene. And thank you all of our panelists for taking the time today to talk a lot about what's going on in our communities, what's going on with public health, and defining public health a little bit more broadly. It's a big, huge topic. And so we'll definitely host more of these kinds of conversations. The next Impact and Coffee will not be next Tuesday. It'll be 2 weeks from now on May 5th. It'll be at 9 a.m. We'll be on Zoom, and we'll make sure that we send out information to all of our audiences out there so they can participate. I've met so many people that have never been to Impact and Coffee before, so it's really amazing to get new people coming to our events. We've consistently gotten over 45 or 40 people coming to these phone calls every Tuesday for the last few weeks. So it's great to keep on continuing this conversation, especially in lifting up these stories during the pandemic. So yes, some last things. This will be recorded, will be available within 48 hours. It'll be posted on our social media probably in the next couple of days, and then our email newsletter on Friday afternoon. And so if you're not on that email newsletter chain, send us your email in the chat function before you go, and we'll add you to the list. The next Impact and Coffee again will be May 5th at 9 a.m. Big thanks again to our panelists. Big thanks to our volunteer team, Mariah, Aaron, Michael, Destiny, Juan, and Jamie. They're amazing folks that do all these really great things to make this happen. And to all of you in the audience, thank you so much for joining us and continuing to support us. We really appreciate it. Hope you have a really great rest of your Tuesday and the rest of your week, and may all your lights be green.
Thank you for having us.
Thank you, everybody.
Thank you. Have a good day.
You too.